Hello, I'm Dr. Paul Smith. Thank you for joining me on another one of my educational modules. This one is on hormone replacement therapy. Women are seeking good information to make good decisions. And there's a lot of information surrounding hormone replacement therapy that can be confusing, even with a reputable source. And then there are other internet sources that have agendas. So women really are seeking good information to make good decisions. I would like to share with you some of my philosophical opinions and some information that might help you decide whether or not hormone replacement therapy is for you. From an evolutionary standpoint, menopause is a brand new issue. 400 years ago, there was no menopause. Women didn't survive into the menopausal time frame. And suddenly, now, medical advances have created the situation where women live a third to a half of their lives after the ovaries cease functioning. And I don't think evolution has had an opportunity to separate out who's supposed to live and who's supposed to not, and let normal nature nudge that process along where it's supposed to go. Now, from one standpoint, if your thyroid gland stopped functioning, then you would replace it every day for the rest of your life and you would never think about it. But your ovaries stop functioning and you can be tough and you can endure that, I'm not sure that's the right answer. I do know there are some medical benefits to estrogen. I think once we get some good research, at the end of the day, estrogen will be the good guy and progesterone will be the bad guy. No data, personal opinion, but I think that's how it will sort out. About 12 years ago, the Women's Health Initiative came forward and said, wow, if we give estrogen, there are complications. So let's take a brief look at that study. Cardiac disease kills Americans, kills women, 10 times more than breast disease. And cardiac disease isn't sexy and it doesn't get the race for the cure and it doesn't get a lot of publicity. But cardiac disease is a major issue. When you look at cardiac deaths in America, men have a rate of cardiac death that is much stronger than women's. And there's a point at which women start catching up. And so what is that point? It is indeed menopause. And many well-respected experts feel that if hormone replacement were started at that point, the cardiac disease would continue at its own moderate rate and not have the advance that we see without hormones. Now, the Women's Health Initiative took women who were out here who had been without hormones for a period of time and had clogged their arteries with cholesterol, and they gave estrogen and the cholesterol softened and there were some complications. Heart attack, stroke. The magnitude of the additional risk was 8 per 10,000. And that's a fairly small number, but if it's you, it's important. But when we look at modifying risk, the conclusion of that study was you shouldn't use estrogen as a primary reason to fight cardiac disease. And I think that's true, but I think there are some benefits. When you look at some of the other benefits, we've got the hot flashes. And for women who suffer, they can suffer and they can suffer for a long time. Hot flashes can interfere with sleep and you have chronic fatigue and you have mood and memory changes and you have distractions with your lifestyle and with work. There are calcium effects and you can lose calcium from your bones. There is some pelvic relaxation effect, vaginal dryness and difficulty in having relations with a partner. When you look at this entire constellation of things, there are a number of positive points on what hormone replacement involves. That's an individual decision for each woman. A very good friend of mine said to me when she had her menopausal transition, I don't want to take hormones. And then she was not sleeping and she was having hot flashes and she really didn't feel good. And so she decided to try estrogen My preference, my personal preference, is for the transdermal estrogen, the one that goes through the skin. Hers is like a hand sanitizer. She rubs it on every night and it gets absorbed. Estrogen replacement that enters the body that way doesn't go through the liver like a pill. It doesn't bind to proteins, and I think there are some benefits. So she started estrogen, and she felt better. Her quality of life was improved, and I think that's the bottom line. It's quality of life. If I have a woman who comes to me and says, "Hey, doc, my period stopped 8 years ago, and I feel great," then if she feels well, then I don't know that adding estrogen will make her weller. Now, there are things she can do. She has to exercise, and we have to look at calcium and her bones, and there are some collateral health issues that need to be investigated. But in terms of saying, wow, you ought to take estrogen, that's an individual decision for her. And that's one that I discuss with my patients when we sit down to talk. And so there's a lot of information out there. Good information has to be filtered and then has to be evaluated in the matrix of who you are and how to improve your quality of life. So that's the focus when I discuss this issue with my patients. And so I hope this information has been useful to you. If I can help you in that decision making, come in. I would be happy to see you in my clinic.